Young kids are one step closer to being eligible for the COVID vaccine. FDA advisory panel recommending approving a lower dose of Pfizer's vaccine for kids aged 5 to 11. Now the FDA and the CDC will make their final decisions in the coming days. Here to help us break down what to expect and what we as parents need to know, NBC News medical contributor, Dr. Kavita Patel. Dr. Patel, good to see you.
Good
Thanks
morning.
for being here.
Good morning.
Good morning, everyone.
So after this recommendation, we're now waiting for the FDA's final ruling and then the CDC to sign off on it. So how soon do you think we'll be seeing needles actually for kids ages 5 to 11 at the pediatrician or wherever they get these shots to actually start getting them?
Yeah, Al, we could see shots in arms as early as late next week because the CDC's advisory committee meets Tuesday, Wednesday, sends that recommendation, as you mentioned, to the CDC director. And Pfizer is ready and waiting with different colored vials and smaller vials that are ready for pediatric sizes out to roll out to practices like mine and ones near you as well.
Can I tell you a hot topic in my parent circles? I can show you the text messages as we speak. It's extremely rare, but a lot of us, and I'm included here, are worried about myocarditis. It's still a concern for parents out there. It even came up, in fact, during yesterday's advisory meeting. Can you talk to us very quickly about that? What should people be watching out for? And does this type of inflammation affect this age range as much as it does for kids who are a bit older?
Yeah, so Chanel, a couple of points of good news. In general, even before COVID, this 5 to 11 age group, you just do not see cases of myocarditis in the same degree that you would see it in older children. Now, of course, that's no cold comfort to parents who are obviously worried about it, but it is reassuring that we generally do not see this in the 5 to 11 age group. The CDC and the FDA have also collected data. The FDA went a step further and modeled data to look at kind of, quote, worst case scenarios. And about 1 in 10,000 children who receive the vaccine in a worst case scenario might have this inflammation of the heart. But here's the good news. The CDC's data so far supports that all of these cases, very rare, all of these cases and real world evidence have actually resolved completely without hospitalization or anything.
So the kid doesn't
really
have any problems after that.
They can have symptoms that can last several months, and we still recommend a cardiologist to look at them and restricting their activity because we want to make sure they're as safe as possible. But key points, very rare. Number two, all pediatricians and physicians are heightened for their awareness after the shots. It's generally after the second dose. But of course, we're going to be looking for anything concerning. And here's where it kicks in. A mother's and a father's instinct reigns supreme. Something seems off with your kid. Come in so that we can make that evaluation and get them to a specialist if we need to quickly.
So you just said second dose. Is one dose enough for some children? And also another main takeaway, where can parents go? Any location to get the shot?
Yeah, great question, Jill. So number one, it's 2 doses that have been recommended by the FDA's advisory committee, separated by 3 weeks, of the Pfizer vaccine. But you're highlighting something that I think is a good conversation. About 42% of children aged 5 to 11 have had the coronavirus, according to the CDC. That's a lot of kids. So many parents, especially if you know your child has been infected, could have a conversation that says, would one shot be enough? Now, I would still recommend 2, but I always recommend open conversations, asking the question, and of course, tailoring it to your children's individual needs. That's the key here, making sure that you have your child's best needs in mind. Overall, my kids are going to get vaccinated. I think the benefits outweigh the risks, and I felt very confident looking at that data that the FDA reviewed.
All right, that's great news, really reassuring. Dr. Kavita Patel, thanks so much, and thanks for joining. Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.